A disease is referred as rare when it affects less than 1 in 2,000 people. Rare diseases, which nevertheless affects 3 million people in France, nearly 4.5% of the population. To date, between 6,000 and 8,000 rare diseases have been identified worldwide, and new ones are discovered every week. Also, in 80% of cases, rare diseases are of genetic origin, and 85% of these have no associated curative treatment. Since 2005, the French Ministry of Health and Solidarity has launched 3 national rare diseases plans, PNMR, which frame and structure the government commitment against rare diseases. The first national plan, PNMR-1, identified a number of rare disease reference centers, CRMRs, which bring together highly specialized multidisciplinary teams for a rare disease or group of rare diseases. The reference centers are primarily intended to provide care for patients, but they also have teaching, training, and research purposes. In support of the reference centers, the Centers of Competence provide care and follow-up for the local patients closest to their home and participate in all the duties ascribed to the reference centers. They complete the French network. To facilitate collaboration between various care providers, the French Ministry of Health and Solidarity has created the French Rare Diseases Networks, active since 2015 as part of the second Rare Diseases Plan, PNMR2. Their purpose is to manage and coordinate actions by bringing together reference and competence centers, diagnostic laboratories, research units, universities, educational, social, and medico-social structures, and patients' organizations. The networks are organized by groups of rare diseases that either attack the same organ or system or are similar in terms of symptoms, consequences, or patient pathway. The French Rare Diseases Networks have 3 main missions: to improve the overall care of patients with rare diseases, to promote research, and to develop teaching, training, and communication. To improve overall patient care, the French networks contribute to epidemiological monitoring by completing the French database of rare diseases, BNDMR. They spread knowledge of rare diseases for health professionals and the general public, along with the recognition of expertise among institutions. They support in particular the harmonization of practices by drafting and disseminating National Care Guidelines, PNDS, and list the expert structures and health professionals in metropolitan France and overseas. The French Rare Diseases Networks also support and coordinate research works and promote the visibility of these projects at the national and international levels. In the context of these various missions, the French Rare Diseases Networks work together with the European Reference Networks, ERN. Finally, the French networks improve the education and training of health professionals by organizing seminars, some with universities or training organizations, or by conducting online courses and video tutorials. More broadly, they promote access to information by carrying out communication actions aimed at the general public, professionals, patients, and their families. Since 2018, a third National Rare Diseases Plan, PNMR3, has strengthened the actions of the previous national plans by perpetuating the central role of the French Rare Diseases Networks in coordination with the reference and competence centers.